Hello, everyone, and welcome back to season 2 of Transform 360 podcast, where science meets compassion and we explore the wellness from a whole person perspective. I'm your host, Sabar Shah, the clinical pharmacist, pharmacogenomic specialist, and founder of MedDN Health. As we are recording just ahead of 4th of July weekend, I would like to wish all of our listeners a safe and joyful holiday. Holidays are a great reminder that our health allows us to fully enjoy life's special moments. And that's what this podcast is all about, bringing you practical, evidence-based conversations that empower you to take more personalized approach to your health. And today, I'm so honored to have an amazing guest with us. I would like to welcome Kitty Wu Ham, a board-certified family nurse practitioner and the founder of Enlighten Holistic Health. Kitty has been caring for her patients in the Boston area for nearly 2 decades and has built an impressive career spanning family medicine, allergy and immunology, ENT, dermatology, and pain management. She earned her family nurse practitioner degree from University of Texas in Austin and has continued expanding her expertise through advanced training in functional medicine and also as a certified Ayurvedic counselor. Her practice combines evidence-based medicine with nutrition, hormone optimization, functional medicine, and Ayurveda to help patients uncover the root cause of chronic health concerns. Kitty, welcome to Transform 360, and we are so happy you're here.
Yes, thank you so much, Sawa, for having me. I'm excited to speak with you today and help educate people more about what they can do for their health and wellness.
Perfect. Thank you so much. Kitty, I know you have an impressive and a very broad and diverse background and experience. I would like to know what inspired that journey, and was there a defining movement that made you realize that there had to be a better way to care for patients beyond just simply treating them?
Yes, I work with so many people in my almost 2 decades now of being in the profession I'm in medical healthcare. And there's a story I want to tell about healthcare and health and what brought me to being interested in getting into what I'm doing now. That story starts with a girl. She was around 10 years old and she was an immigrant from Asia and she immigrated to the US around 3 years old. But at 10 years old, she was diagnosed with autoimmune disease, inflammatory disease, which most people are familiar with, eczema, which we know best as, if you're familiar, I'm sure you're familiar with it, Sava, dry skin, itchy skin. But I don't think people realize that it is an autoimmune inflammatory disease. And it can be chronic, for years and years or someone's whole life. So this girl, she, diagnosed at 10 years old by a dermatologist, which is pretty typical. And the dermatologist told her, here's some steroid medications. Let's change up your soap and make sure you're moisturizing your skin. And I'll see you back in a year. And so each year, she'd follow with the dermatologist just like he told her to. And yeah, the medications did help. But when she didn't use the medication, the skin would get very itchy, irritated, oftentimes even ooze and was very uncomfortable throughout her body. And then at one point, the dermatologist had to add an additional medication because it was so bad. But with that combination of two medications, it cleared up as long as she was pretty regular with it. As years went on and she was getting close to adulthood, we saw this dermatologist for, close to 10 years, and it was just kind of the same thing every year. But when she was getting older, she was getting educated or interested in healthcare too. And she was getting into training, going to nursing school. And during her nursing school training, she was seeing a lot of patients and washing hands, which is one of the things that can irritate the skin if it gets too dry, if you're overusing soaps and things. And so she asked the dermatologist, well, my skin's getting more irritated from washing my hands so much. What should I do? And he told her, don't wash your hands. Well, when you're seeing so many patients throughout the day and you're going room to room, especially with patients that are infectious with other diseases, you want to prevent that by hand washing, good hand hygiene. So at that point, she had to stop and think, well, that doesn't seem reasonable for what I'm doing. And then, I keep seeing you every year. There's really no other help in figuring out, could this be something else that's causing this issue? That's when she stopped seeing the dermatologist and went on to figure out other ways to manage her health. And that story is my story. That's my personal story as a child during
Right.
my childhood, that I went through this cycle of conventional medicine, not really identifying what triggers were causing my issues. And eventually I figured out, diet was playing a big role. Allergies was playing a significant role. I'd never been allergy tested. No one asked me about my diet
Oh,
or my lifestyle. I slept late. I was a kid. I slept late. I was an immigrant. Socioeconomic wise, we had struggles and things. So all those factors play into a role that could have been dealt with early on in life. But I've spent years and years of most of my life trying to identify how to cure my eczema. And I'm so proud to say that I've cured my eczema. I don't even use those medications anymore.
but
And I've
that's
helped
amazing. Yeah.
thousands of other people do the same.
Hey, that's amazing.
And so yes, it is my passion and my purpose to help others kind of find better ways to help and manage their health, but and also really to understand how their body's working and why it's that way. If there's imbalances, to teach them how we can get the body back in balance.
That's amazing. Thank you for sharing your journey with us, Kitty. That really helps. Because in the same way, in the traditional medicine world, people have been taking medications for so long, but there are not a lot of people who would look, what is happening under the carpet, what's happening under with the inflammation and other stuff. So I'm glad that you were able to cure your eczema, and that's amazing. That was my next question. I would really want you to explain how these allergy drops, I know you do customize them for different patients. How do they work and how they differ from traditional allergy medications, over counter medications we have, and people, as you're mentioning, because a lot of people have skin issues. How
Mhm.
can they come to you and how would you be able to help?
Yes. And so not only did I find my purpose and passion through my personal story, that led me into getting more education in how to help people health wise. I'm trained in nutritional support. I did undergraduate work in food science and nutrition. And then that led me into nursing school, which and as a nurse practitioner, the foundation of nursing school and nurse practitioner school is very holistic, which I'm proud to say. And so it is a little different from medicine in the way that we look at the big picture. We do consider lifestyle factors. So that's helped in my training. And then from there, I got educated in family medicine and got certified and have my master's degree and postmaster's in family medicine. And then as I worked in family practice, I got trained in allergy and immunology. And that's where I learned how to formulate allergy drops and shots based on allergy test results. And I do that by doing skin tests. It's a skin test called a prick test. But luckily, it sounds a little daunting, but luckily it's non-invasive or very minimally invasive. It's a little plastic kit. It looks like a little stamper. And we
Okay.
stamp it on the skin, and then it applies a bit of the allergen. And after 20 minutes, I can tell what someone's allergic to. And not only that, I can measure the severity.
Nice.
And
Okay.
based on the severity of someone's reaction is how I formulate the allergy drops. So it's not just like I'm just making something up in my head. And there's a very specific formula and measurements. It's very scientific on how to make allergy drops for someone. But yeah, this is a great therapy. We call it sublingual immunotherapy because it
Okay.
goes under the tongue. And it's formulated very much in the same way as allergy shots.
That's okay.
And the idea is over time, we're teaching the body to become immunized or teaching the body to build up antibodies, kind of like a immunization, like a vaccine
Yes. Uh-huh.
that tells the body not to overreact, tells our immune cells not to overreact when we're around this sort of allergen.
That's amazing. So, Kitty, you mentioned that you would, the same thing with the prick test. So, how do you typically determine like what allergens, like I'm sure in the history, because typically when we go to a dermatologist or we go to our primary care providers, they would do a kind of a prick test or allergy test mostly on the back or mostly on the arm. So is it similar to that, or is it something different?
No, it's very much the same. Yeah, this is the same test that allergists would do, but dermatologists do like to do what's called patch testing. So I've done both, and since I'm trained in dermatology too,
Yes. Huh?
but it's a little different because patch testing focuses primarily on common skin irritants like
Oh,
different chemicals. Even nickel is a common skin irritant and allergen. So dermatologists don't typically do the same type of allergy, but this is an allergy test to check your allergic reaction, which is based on your IgE reaction. These are your immunoglobulins, your immune cells that are focused on responding to an allergic irritant.
makes sense. Yes. And
So it's very specific to that.
yes, yes. Another thing I would like to ask is anyone who's listening, who is typically an ideal candidate, and how long does the treatment usually, how long does it take for the treatment to be in effect so patients can start noticing improvements?
It's a great question, Sabah. Who's an ideal patient for this? Honestly, everybody should get allergy testing. It's very fascinating how much allergy is involved with how our body works, especially living in Austin. We are around so many allergens that irritate people's bodies. Everybody's body is a little different in how it reacts and then how it ends up affecting our body. Allergies, when we talk about allergies, a lot of people think about having runny nose, sneezy, coughy, itchy eye, sore throat. But that's not for everybody's body. Some people have a headache. Some people just feel fatigue and foggy headed all the time. Allergies can be very subtle to very severe. It can even just cause us some stomach upset, diarrhea often, just not, just cause the body to not work as well as it should be.
Should be.
So that's why I think it's really great information to have for everybody to at least rule out or know how their body's reacting so that if you do testing and it does show something or it doesn't show something, at least you kind of know my body's not overreacting to allergies or my body is reacting to a lot to these irritants that I didn't
That's true.
more than I realized. And that's usually what I'll end up seeing when I do test people is that there are reactions they didn't even realize until we checked it out that their body was reacting in that way. And then if they do have reaction, right, they have the option of doing a personalized treatment that I formulate that does help the body teach the body not to be so reactive. And
That's very
generally
cool.
that course of treatment can take 2 to 5 years.
Okay.
Allergy shots take twice
Yeah.
as long. It can take about 5 to 10 years because shots you go in once a week. And then depending on reaction, if you are having any reactions, you have to reduce the concentration of that
Mhm.
formulation. And then you have to adjust it so that you're not overreacting somebody.
Yeah.
But drops you do at home on your own daily, and there's less side effects, there's less risk of reaction, and then that consistency daily helps the body learn a lot faster of how to not be so reactive. So then you have quicker results.
That's amazing and very cool. That's very different from what we have seen in traditional healthcare setting. Another question was, do you take insurance or do you offer any payment plans for people who are paying cash?
Yes, yes. So I don't bill insurance directly, but we can utilize insurance by submitting a receipt. And I have a lot of clients that have insurance or don't have insurance. So I work with whoever and wherever they're at and help guide them on whatever we need to do to help get them taken care of. But if you don't have insurance or do have insurance, there's ways to manage that. And then I do offer payment plans and I offer, affordable costs to make sure this is accessible to everybody.
That's amazing. And another thing you mentioned, are you licensed in other states as well, Kitty? I know you're licensed in Texas. What other states are you licensed?
Yes. Yes. Colorado, currently, I'm also licensed there. And then I'm working on, actually, I put in an application to get licensed in New York and New Jersey. And I'm
Very
working
nice.
on California. And I also do,
That's
consults too. Even if I'm not licensed in someone's state, I'm happy to talk with them on what options they do have and what they can do to help with, whatever issue they may be having.
Wow, that's amazing. Thank you for doing what you do, Kitty. It's so unique. I know so many practitioners, but I think probably you are the only one who is doing these customized allergy drops or the sublingual therapy. I haven't met a lot of providers who are doing it, specifically in the Austin, Texas area. So thanks for doing what you're doing. Another thing that
Yes.
really sets your practice apart, in my opinion, is your training in Ayurveda. Many
Yes.
people may think of Ayurveda as something that's completely different from the Western medicine.
Mhm.
How do you integrate Ayurveda principles with the functional medicine and your conventional training in a way that's more practical and, it helps a lot of other people?
Yes, I love Ayurvedic medicine. So that's just an additional part of my training. And what I love about what I do is I continue to get educated to help people better than before. So that is a passion of mine, to continue helping people as much as I can and doing it even better than you know, year before. So I've been utilizing Ayurvedic medicine in my practice for 7 years now. And I got interested because I did yoga teacher training several years ago.
Cool.
I
Okay.
was in kind of a turning point in my life. I wasn't sure if I
Yeah.
wanted to stay in healthcare. And honestly, I was getting burnt out in
Agree.
traditional conventional healthcare.
Agree.
I wanted to find a better way to help people. And I'd always wanted to do yoga teacher training. So I went ahead and did it at that time. But Ayurveda is a sister science of yoga. And Ayurveda in Sanskrit means the science of life. If for people that are not familiar. So it really encompasses all of our own body's health, but how our lifestyle, our foods we take in, our environment, our universe, how it all interplays and how our body's working. It's a beautiful science and beautiful knowledge to incorporate. And I use a lot of the foundational tools to help people. And actually functional medicine, for people that aren't familiar with it, functional medicine is kind of a evolving newer form of medicine that is a system-based biology, kind of identifying how the body works systematically, similar to Ayurveda. And it actually utilizes a lot of principles from Ayurvedic medicine in its practice too. So it works really well. That they go hand in hand. And if you've heard of turmeric, if
Yes.
you've heard of ashwagandha,
Yeah.
these
Uh-huh.
are all herbs that have been used in Ayurvedic medicine for thousands of years that we still to this day utilize because they work so well for the human body.
That's true. That's amazing. Thanks for explaining that, Kitty. Now, I would like to shift to a topic that affects every woman or is going to affect them at some point in their life. But unfortunately, they don't receive enough education or support. That's perimenopause and menopause. And we
Uh-huh.
typically know that menopause is defined by a time where woman doesn't have her menstruation for at least 12 months. But many people
Correct.
don't recognize that the ovarian dysfunction, it starts at a very early age, even long before they hit that stage, maybe up to like 10 years or so. And that transition time is called perimenopause. And
Hmm.
typically in US, the average age of women when they go through perimenopause or menopause is, sorry, for menopause is 52, and the perimenopause starts around like 40s. But for some people it's
Right.
early. Now what I'm saying is it's late 30s, and early 40s. So what, you being a woman, what do you wish that every woman understands about the transition, and what are some of the earliest signs that women often overlook?
Yes. This is such a great question, a big question.
Yeah.
I get all the time.
Yeah.
And it's such a hot topic. I'm glad people are talking about it because people weren't talking enough about it, or really not talking much about it for a very long time. And we're seeing it coming to fruition now that it is just a big buzzword that people are talking about, perimenopause and menopause. But what I wish that people would recognize is that the signs of perimenopause, it doesn't mean that everything is going down to zero, that we're just doomed. All us women are doomed to have no hormones, zero hormones. That's not what it means. And And then that transition doesn't mean too that everybody has that same transition. Every individual woman has different upbringings and different lifestyles and what each individual body has to go through in their life. So everybody's transition is going to look a little bit different than others. And if you are noticing it sooner, because we are seeing women even in their 30s starting these transitions, but if you're noticing this early, that's a red flag your body's trying to tell you. And that red flag probably was a white flag at one point, that something was off balance. But now it's really out of whack, where the resources that our body has to try to maintain a good balance are depleted. And then it's going to bring this transition to wave this red flag and call out for help very loud and clear. If you hadn't been listening years before, you're going to listen now. So I want women to know that, yeah, start getting to know their body before that happens. Prioritize their health. Everybody, not just women. We got to prioritize our health first and foremost. Whatever job we have, we can't do our job. We can't take care of others until we take care of ourselves.
That's
So I really try to teach people early on to recognize and really get in touch with their health early on in life so that when we start transitioning, it's a smooth sail. We're just smooth sailing, no rough waters. It's just a beautiful transition and easy versus just up and down roller coaster. So you have that choice early on if we catch it early. But if we wait until that red flag's waving and shouting and on high alert, it's a lot more of a struggle.
struggle. That's true. That's true. Even nowadays, because I do work part time as a hormone compounding pharmacist, so that's a very different perspective. What I see in my consulting practice, I still see women who are in their mid to late 40s. I don't know, there's some kind of stigma related to it. As you mentioned, yeah, people are getting better, but I still do see a lot of kind of fear attached to hormones, as if they're going to cause cancer, or everything has to be used in moderation. That's where your blood work and those things are very important. Not everyone
Yes.
needs hormone replacement therapy, as because all of us have been through different experiences in our lives, so we understand it has its own place. But what would you tell a woman, because most of the time women are how they recognize is they have hot flashes, or they have their friends talking about maybe they have vaginal dryness, they have other things going on in their life. What are the
Hmm.
earliest signs and noticing sleep issues? So,
Yes.
is there anything else that you would like to add?
Yeah, again, probably you're just going out there, getting your blood work updated, really knowing your body and your health status
Mhm.
before you start having symptoms. Because once you have symptoms, that's when your body has already been having some trouble. But if you are starting to notice, fatigue, fatigue's the number
Very
one sign and symptom I see people coming in for that could be a sign of a hormonal shift and hormonal imbalance. You mentioned hot flashes, vaginal dryness, low libido. And I see a lot of women also come in and see me if they're having more erratic mood, just feeling irritable, very emotional, kind of that roller coaster, happy or not really happy or feeling more dissatisfied, and then just putting it out on their families and loved ones and not feeling well control, having much control over that.
That's
Definitely
true.
get checked out sooner than later, if that's happening. And you made a good point too, that I liked. Not everybody needs hormone therapy, but that's where, right? Let's find out if you do, and if you do, how can we help you? And yeah, there's very safe, effective ways to manage hormones. And I work with women too, and maybe starting hormones, but maybe getting off of hormones too at some point. I work with 60, 70, 80-year olds that I'm able to get their hormones stabilized and get their body working for them and get them off of or lessen and off of hormones.
That's amazing. Thanks for sharing that. And another thing that I would like to add from my professional experience is hormone replacement therapy. I know we talk just specifically about women, but men at their certain age, they do need their hormones balanced as well, because hormones play a
Yes.
very important role in, your bone health, in your cognitive decline. There are so many other areas
Hmm.
that get affected. So it's just not for women; it's for both of them.
Absolutely, men. Yeah. And we're not forgetting about you. And don't forget about yourselves either. You need to get checked out too and see where your hormone and health status is at. And don't ignore, right, if you're feeling chronically tired, have low libido, mood changes, sleep issues, you gotta get in and see where you're at. Yeah, hormone wise, get some lab work and get that updated.
That's true. Thank you for sharing everything. Now I would like to
Yes.
move to few rapid fire round questions. Those are simple ones. And if you don't want to answer, you can just say pass. Okay. We'll start. Okay. What do you like? Tea, coffee, or herbal teas?
Herbal teas. Yes,
Okay.
everybody, all my clients I've worked with me know that
Yeah.
caffeine's a big driver for imbalance. So I try to find balance where, yeah, getting more of that herbal tea in is hydrating. Not to say you can't have caffeine, but it's all about balance.
I totally agree. If you weren't a nurse practitioner, what you would have decided as another alternate a career path?
I wanted to become a naturopathic doctor at one point, or actually, that was one of my first careers I was looking to. But I lived in the Midwest at the time, which didn't offer a lot of jobs to naturopathic doctors. And then I wanted to be a food scientist. I love food. I'm very passionate about nutrition. So I wanted to be a food scientist.
That's amazing. What's one piece of health advice you wish everyone has heard earlier in their life?
Well, yeah, I gave that story at the beginning of my health journey. Finding a provider that you trust and takes time to get to know you and support you, I think that is vital for everybody to have a guide. And you can only learn so much, but when you get a perspective of someone that's an expert and someone that knows what they're doing and has your best intentions, that is just a beautiful relationship and can really help you lifelong.
That is true. Two more questions. What are things that, when people know about you and they're not expecting? Is there anything that people come across about your personality, maybe, and they're like, we didn't expect this from you?
Ooh, that's a hard rapid fire question. It's deep. I kind of like shared a lot with my personal
Yeah.
story. I'm an immigrant. I used to be shy. I used to hate talking to other, well, not hate, but
Yeah.
I
Yes.
in my culture, I'm taught as a girl, as a female and Asian, to keep quiet and don't speak unless you're spoken to.
Mhm.
But no, in my professional career now, I love talking to other people. I love teaching people. I love connecting with people.
That's amazing. And what's the most fun thing you have done maybe in the past couple of months?
Well, I've had a whirlwind the last couple months. I went to Italy for my 20th wedding anniversary. That was
Amazing.
if my husband and I made it to 20 years, that was our wish to to celebrate there. So we did it. And then soon after, I took my girls to celebrate their birthdays in New York City. That was kind of a wild thing, but they're teenagers, so I thought they would enjoy that. And then I recently I did a session of water therapy called Watsu, a
Okay.
form of water shiatsu. I was telling Sab about this beforehand for my friend Neil at Third Eye Cacao, but it was an amazing journey. It was like doing a ketamine journey, but no drugs. It was just water, being in salt water, but
Wow.
very beautiful and very, yeah, mind opening.
Wow. Okay. And are you open to trying new cuisines and new experiences in your life?
Yes, I love food. Food is such a big part of my life. Being Asian, I'm another thing. Yeah, I was born in Hong Kong, so in part of my Asian culture, we food is just part of our culture. Sharing food, providing food for others, that it means love and affection. So, and I do that with my patients. I love talking about food, but I love all kinds of food. Recently, El Naranjo in town, they're Oaxacan. They're a Oaxacan style food. They're actually closing
Wow.
soon. So anybody that's in Austin, James Beard Award winner restaurant, amazing. They're closing, unfortunately, here
Wow.
later this month. But I hope to visit Oaxaca someday because I love what Oaxacan food brings to the world. It's just a melt of spices and freshness, and
Wow.
it's so good.
That's really nice. And where are they located, kitties? Probably in downtown Austin or South
Yeah,
Austin?
South Lamar. Yes, South Lamar near. There's like Amy's and Phil's. It's near Oltorf and Lamar.
Okay. Okay. The name is Bohakan. I'll just search.
Eldron.
Oh, okay. Thank you. I have to try it before it closes by end of month. So at least I can
Yes, it's so
experience that.
good. You have to. Yeah, they make their own masa. Yeah, it's just like it's a such good. It's just yeah,
Wow. That's
speechless.
amazing.
How good their food is.
Now I have to try it.
Yes, yeah.
Thank
Check it
you.
out before they're gone.
Mhm. Perfect. Okay. I'll definitely try to check it out before uh, you know, they close. And thank you so much, Kitty, for joining us today. Thank you for sharing your story, your knowledge, your passion for helping patients achieve lasting wellness through an integrative and a personalized approach. And thank you to everyone listening to Transform 360 podcast. Remember, wellness isn't about achieving perfection. It's about making those smart choices so you can show up for your family, for yourself, and others around you in the community. If you enjoyed today's episode, please subscribe, leave us a review, and share this conversation with someone you think can benefit from. Thank you so much again, Kitty. It was amazing having you today.
It was fun today. Thanks for having me.
Of
Take good
course.
care.